So there's two main reasons why a slant board increases squat depth. And no, one of those reasons is not increasing ankle dorsiflexion. Real quick, if you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. And thank you so much for watching. Let's jump into today's discussion. So we've all assessed or seen that person come in and do a bodyweight squat, and as they go down, you're just like, that doesn't really look right. It's more horizontal compared to this kind of upright vertical squat that I know we should see. And then you put them on a slant board and their squat totally transforms. That horizontal movement is now replaced with a vertical. Their knees are pushing forwards compared to moving backwards. And you see this, you know that it's better, but you might not know why. And understanding the why helps you better prescribe a slant board to someone that will actually need it compared to someone who might not. So, like I said, there's two main reasons why this happens. The first is center of mass. A slant board, when you stand on it, is going to push you forwards. Why? Because it's inclined, and so when you go on it, your plantar flexed, you're going to fall forwards. So what the body does, and really what the brain does, is it starts to reposition towards more of a posterior center of mass bias. So if we have our pelvis here, if we are slightly forward, when we go on a slant board, it's going to increase that direction and will fall, but if the brain can react, it actually will start to reposition. So this reposition brings us back so we don't fall. It's also going to bring the femur, the tibia, the ankle back, and so everything's starting more back. And that's really helpful because so many people start too far forwards in general. And when we start too far forwards, how do you think a squat looks? Horizontal. Why does that happen? When we're forwards, we're usually going to be more internally rotated at the pelvis. All I want you to think about is that internal rotation opens up the backside of the pelvis. When this is open, muscles are more lengthened. It allows us to move horizontally. So, step number one, center of mass more posteriorly biased, which removes their normal pattern, that normal pattern of being too far forwards. Now, step number two piggybacks off of step number one. That posterior center of mass now creates a pelvis that is more externally rotated bias. What does that mean? That means that the innominate bones are more externally rotated, the sacrum is more counter-nutated, and from a movement perspective, the external rotation closes down the front, so we think muscles in the back of the posterior pelvis are more concentrically biased, which creates eccentric on the front. So we have open on the front. So what does that do? Well, from the back side, when we start to go down, if we start to hinge, the back side of the muscles say, nope, not happening today, and it reorients. It literally acts as a constraint. Those muscles are more tight, we can think of it, and they're going to reorient, and now they help us maintain a more vertical position. So that's the back side. The front is, because we're externally rotated and closed and tight in the back, it allows us to actually flex the leg and start to go through greater depths of range of motion because we're not getting blocked up in here like we see when there's an internal rotation bias. So the center of mass shifts posteriorly. That is met with more of an external rotation bias. That external rotation bias acts as a constraint in the back, so we prevent the horizontal and move vertical, and the space in the front allows the femurs to move and go through greater depths. That's the two main reasons why we start to see a significant increase in squat depth once we add a slant board. Now, at the beginning of this video, I said you'd understand the why, but also the who. I talked about it briefly, but I want to circle back to it to make sure it makes sense. Patients that are more anteriorly oriented and have more internal rotation at the pelvis are going to be biased towards moving horizontal. So these are the individuals that would tend to be more advantageous to use a slant board because it's helping them find a position that they struggle to achieve on their own. They struggle to achieve a posterior center of mass and an externally rotated position. So these people do really well with slant boards. Conversely, someone that's already externally rotated, a little bit more slouched over a narrow ISA, they aren't going to necessarily need a slant board because that's their normal position. They already do well with finding external rotation, with finding a posterior center of mass, and so sometimes it's overkill by putting them up there. Obviously, it depends on every single person and their unique scenario, but as a general principle, the ones that are internally rotated and extended wide in for sternal angles tend to be better on a slant board.